listeners, a warm welcome to Views on Health. And this being the first program for the year 2023, we're delighted to have with us tonight on the program Dr. Geethika Patabendige, who's a consultant clinical microbiologist at the National Hospital in Sri Lanka. A warm welcome to our studio, Doctor.
Thank you.
And for the information of our listeners, as a clinical microbiologist, Dr. Geethika Patabendige is going to focus on antibiotics, misuse, and overuse. Having said that, in Sri Lanka, we do find that patients tend to take in antibiotics for the slightest ailment, which is not permitted in medicine. Doctors do not prescribe antibiotics. But then, unfortunately, the system is such in the sense that patients are able sometimes to get hold of antibiotics through various sources, and they self-medicate. That's one aspect of it that the medical fraternity here is facing when they see patients. Sometimes patient has already taken an antibiotic before coming to a doctor with a particular ailment. And then there's a doctor trying to see how best to sort it all out, because already the patient has started on medication or has finished it and has come to the doctor. On the other side of it is that patients also tend to not complete their course of antibiotics when it's prescribed by a doctor. A doctor, once he or she diagnoses the patient and thinks that, okay, according to this diagnosis, I need to prescribe this antibiotic or antibiotics, as the case may be, to this particular patient. So the patient takes it for 2-3 days and then doesn't complete the course because he or she feels much better by that time. So these are issues that doctors face when dealing with patients, and to tell us, advise us how best to proceed is Dr. Geethika Patabendige in her capacity as a consultant clinical microbiologist. Having said that, Doctor, once again, may I hand the microphone over to you to introduce this topic to our listeners.
Yes, thank you, Fatima. So it is important for us to talk to the community people. You and I both in the community. Though I am a doctor, I am also living in the community. So these antibiotics are a group of medicines which are included in the bigger group of antimicrobials. So antimicrobials include antibiotics, antivirals, antifungus, and antiparasitic drugs. They are actually precious drugs, and I am going to focus on antibiotics today because it is the drug out of all which is misused or overused in the community. So it is worth talking about antibiotics, taking time. So antibiotics work for bacteria. It doesn't work for viruses, fungi, or parasites. So it is important for all of you to understand that antibiotics are not going to help in relieving your infection if it is due to bacteria. Most of the infections we come across are due to viruses. But people think that antibiotics work for each and every pathogen. Pathogen means disease-causing microbes they take. So it is actually not helpful, and it mainly causes harm to the patient. And the other thing I must stress is they are life-saving, as I said earlier, and they are precious drugs if used appropriately, rationally, not irrationally. So people, for small, mild infections, you sometimes feel little feverish and little bit of cough and runny nose. You tend to take antibiotics without any prescription. But antibiotics, of course, has to be, in Sri Lanka and many parts of the world, it has to be prescribed by a qualified medical officer, registered the Sri Lanka Medical Council. It has to be a Western doctor prescribing antibiotics. It is the regulation in the country. But we know that there is over-counter sale of antibiotics. It is prohibited, but it is happening in the country. So you have to understand that viral infections, like mild viral infections, and even maybe due to bacteria, mild infections, we need not to take antibiotics. We should not. Actually, it is harmful. But in severe infections, it is necessary, doctor has to decide whether the patient should be given antibiotics or not. So it has to be done after examining the patient. Otherwise, patient should not decide to take antibiotics. We understand that a lot of people, knowingly or not knowingly, they take antibiotics as they wish. So it causes damage to our gut microorganisms. We have very helpful microbes in our gut. So after taking these drugs, they kill or inhibit our gut microbacteria. They are called microbiota, and the genetic composition is called microbiome, which is very helpful. Which is very helpful means they are very helpful to produce nutrients and vitamins and for our metabolism and digestion of some of the food we take, and they are very helpful to keep our healthy lives. But by taking unnecessary antibiotics, we tend to kill those useful bacteria and we become ill simply because of that reason. And the other thing is, for severe infection, of course, there are people in the community, I know, the medicine is ever developing, and a lot of people with reduced immunity are there. Those who have undergone transplant surgeries, those who are taking under doctor's advice, taking some of the steroids and immunity reducing drugs for medical reasons. So they should not take chance for 2 to 3 days. Normal person can wait for 2 to 3 days before seeing a doctor to see. Doctor has to decide whether to give antibiotics or not. They can wait for 2 to 3 days if it is a viral infection with a simple remedy like kottamalli, the famous thing, kottamalli. When I was a small child, my mother gave me kottamalli and the viral infection resolved. Likewise, it's happening. But those who are having those problems like medical reasons, they have to see a doctor immediately, because doctor has to decide whether the medicine, this antibiotic has to be prescribed or may need to keep the patient as an inward patient, of course, and monitoring. And the other thing, that those who are in the community, what they do is, one similar type of symptoms, either fever or a little bit of cough, runny nose and a small wound, they tend to take antibiotics prescribed by a doctor to some other family member or a friend. That is the worst thing you could do. That is really, really bad. It should not be done, because doctor has to examine and realize that this is due to possible bacterial infection. If he is in doubt, might ask for some laboratory confirmations like urine culture, for instance, for urinary tract infection, or some other biochemical testing, very important ones, before coming into a conclusion. Or else, if they think that if he or she, the doctor thinks that this is likely to be more in favor of bacterial infection, she or he starts you on antibiotics.
Thank you so much, Doctor, for that very detailed and lucid introduction to our topic of antibiotics and its misuse and overuse. Unfortunately, in Sri Lanka, there are a few chemists who tend to who have their outlets in various parts of the country, and they tend to sell antibiotics without a prescription. And this is where the problem starts, because if the patient, even if he or she wants to self-medicate, if there's no access to it, obviously they can't take it, buy the drug and take it in, because nobody's going to give it to them. But if it's available, then they do go to the extent of buying this, whatever the drug is that they think is needed at that point in time to settle their health issue, and they go on taking it, and then again they don't take the complete dose. They just take for maybe 2-3 days, as I said earlier. So these are issues that even your other colleagues in other fields of medicine, in the course of their discussion on various topics, have come up with this concern, because they say we prescribe something, but then the patient doesn't actually complete the course, or on the other hand they go and self-medicate. Physicians complain about it, but then it's beyond our control. Having said that, doctor, just to check with you, as far as antibiotics are concerned, obviously various tests will be done on the patient concerned, or whatever the doctor, the qualified doctor, is the consultant, will decide, I need to prescribe this for this patient. So based on that, how would you say that will a doctor actually consider many factors before prescribing an antibiotic?
Yes, definitely. So actually these antibiotics without a prescription, nobody is allowed to get antibiotics according to the law of the country. But the thing is, some of the places it is prescribed. The thing is, doctor consider quite a number of things before prescribing antibiotics. The site of infection, possible infection, site of infection. Sometimes it is quite obvious, but sometimes it is not. Site of infections and functioning of the different organs of the body. Different organs of the body. It is very important. So that is why the patient should declare whatever the diseases they have to the doctor. It is very important. If the patient is pregnant, especially pregnant mothers, they have to declare, they have to tell that they are pregnant. So depending on that, the functioning of the different organs of the body, site of the infection and dose also matters. So depending on those factors only, the doctor prescribe a dose to a patient. So that dose also depends on the site of infection. Sometimes in severe infection, patient may need antibiotics which penetrates your brain. Sometimes with severe infections, not others. So we might have to use higher dosage which penetrate into the brain. But others, the doses are different. So your body organ functioning also, there are recommended doses. We call them recommended doses for different infections. So doctor has to decide, considering all these. What is important is the concentration of this antibiotic in the blood is important for you to have an effective killing of the microorganism, that is bacteria. So that is why we always tell the patients and as you in the community that it is important for you to see the doctor and not to misuse or overuse antibiotics. as Fatima said, sometimes they use family, the whole family. I have fever, you have fever, mild cough. All the people in the family take antibiotics. They share antibiotics. That is really, really bad. And you all should, I have to emphasize the point that a lot of diabetics are in our community. So it is important for you to control your diabetes and take other drugs prescribed to you by the doctors for other illnesses, because sometimes the diabetics are more prone to infections, so though you are liable to get more infections compared to others. That is, you can have diabetes, it is not a problem, but controlling of diabetes is the most important thing. So uncontrolled diabetics are liable to severe infections. So that is what I need to emphasize to you, not to take over-the-counter sale, not to do, those who are in the pharmacies, not to give antibiotics over the counter, and patients you for a mild infection, if you don't have severe diseases or transplants or other immunity reducing drugs, you can wait for 2 to 3 days before seeing the doctor. If you have those infections, you have to see the doctor. If you immediately, if you don't have them, you can wait to see whether it is a viral infections or relieving can be observed in 2 to 3 days, probably 3 days. After that, you have to see a doctor to get the prescription from a qualified Western doctor registered in the Sri Lanka Medical Council, not to share them with others and not to stop taking, to stop antibiotics. If it is prescribed for 5 days, you have to take for 5 days. If you have been prescribed for 7 days, you have to complete the course. That is, I need to emphasize. And sometimes they think, no, this may not be adequate. I have to take it longer, for 10 days. No need. So it is harmful. So you have to take the antibiotics as prescribed by the doctor.
Doctor, question, what is the difference between antibiotics and other drugs?
Yes, very important question actually. The other drugs, of course, anti-diabetics, antihypertensives, those drugs really become, there's nothing called resistance to antihypertensives, anti-diabetics. But antibiotics are special. They become resistant if misused or overused. They become resistant means once we use that particular antibiotic, say amoxicillin or ciprofloxacin, whatever the antibiotic, for that particular infection, there is relieving and killing of the microbe in the first instance. And maybe second instance also it happens. But after that, if you use the same antibiotic, it is not going to work. So the thing is that for that particular microbe, this drug is not going to work anymore. So the other thing is resistance development is not seen with other antibiotics, and because of that reason, the drug manufacturers do not want to produce new antibiotics. So during past 2 decades, they are not developing or manufacturing new groups of antibiotics, because once produced, manufactured, within 6 months, in 1 year, they become resistant. So the production of an antibiotic is very costly. It takes longer time with trials trials. Different stages of trials have to be done. So ultimately, after 6 months, 1 year, drug cannot be used for many of the microbes. That is called multi-drug resistant organisms are there with us. So it is very important we have to adhere to rational prescribing by the doctors. That is also we are training, we have guidelines, the doctors. Rational prescribing and rational use. So the patients also should consider not to misuse or overuse of antibiotics.
Doctor, just a question. Time is catching up with us. It's been interesting listening to you speak of antibiotics as a drug for various ailments and the negatives of misusing or overusing these drugs. What about its effectiveness in the long term? You did say that after a while that it won't be that effective. I mean, it's in your system, but it's prescribed for a period. Would the doctor need to re-prescribe according to the situation, the patient's condition? And if so, would they prescribe the same or would they change according to the need?
Yes, Matima. The thing is, the doctor has to decide whether he or she needs to prescribe it longer. There are some diseases that we prescribe it for longer periods. That means that there is an indication for the doctor to continue antibiotics for few weeks. There are special instances which is decided by the doctor, not by the patient. So the other thing is, if we do this rational prescribing by the doctors, which we minimize now, and if patients misuse, there will be nothing left for us to use for severe infections in years to come. So the important things, already the World Health Organization, it is a global health issue. It is a problem in most of the developed countries, but it is a global health issue. So there are national strategic plan, which is implementation is done in Sri Lanka as well. So my request for all in the community is for you to not to misuse or not to use it for a longer period. Use it as prescribed by a doctor. If not, there won't be anything left for our future generations to be used for severe infections. Thank
you, Doctor. And on that note of solid advice, we end this very interesting discussion on antibiotics, misuse, and overuse. Thank you so much to you, Dr. Geethika Patabendige, consultant clinical microbiologist of the National Hospital in Sri Lanka, for sparing your valuable time and being with us on the program. Thank you so much, Doctor.
Thank you.
My thanks also go to Kalyani Egodage for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday, same time on Views on Health.